Yeah, you know, we think this is an incredibly important conference. We think the foundation does really important work here because the challenge I think we've faced as a country improving healthcare delivery has largely been the complexity. The ecosystem is so vast. There are so many different stakeholders, and oftentimes you can look at that situation and almost be paralyzed by it. I think what the foundation is creating here with the mHealth Summit and the other related activities is to provide and facilitate for people coming together and determining how we build a coherent ecosystem to attack some of the major challenges facing healthcare delivery. Yeah, you know, I think all of these parts are so important. You know, they all are interconnected as well. One of the areas that we have taken on as part of our broader healthcare strategy is enabling mobile clinicians to be more effective in their work. And so when you think about the movement of digital health records in a secure fashion over a broadband network to a mobile device, this is an area that we're very interested in. We think that the mobile clinician can be that much more effective if they have access to that information and if we can improve their workflow through automation. So when you consider all of the different aspects of healthcare delivery, there's almost no place where you'd say, well, you know, technology can't really do much to improve that situation. It's a very, very rich environment of opportunity here. And you know, as we think about it as a business, we have on the one hand the value that we'll create for our shareholders. You know, it's business. But you know, what's really exciting for our employees and for our company broadly is also the societal benefits. You know, how do we attack some of these major, major issues that we've struggled with for a long time? And we do believe that by partnering with the foundation here and all of the stakeholders in the space, we can make a real difference. You know, I think for us, it's a journey. And as we've gotten involved here with the summit, the first thing that we've gained is just access to all of these different stakeholders. And really, it starts by understanding who they are. You know, who do you need to work with to get from point A to point Z? And every industry is different, but healthcare in particular is pretty substantial in this regard. A lot of different stakeholders, and most of them are represented here today. So this is a very big deal for us, and the main reason for our interest in sponsoring and staying very close to the foundation. Yeah, you know, we talked today during the keynote session about our digital care management platform, which we think is a very, very important piece of work. We've been on it for almost, well, a little bit more than a year now. And you'll see in the middle of 2012 that we'll take this to the marketplace. And the digital care platform is really designed to assist patients to manage their chronic diseases. One of the things that we saw as a real opportunity was how do we create tools for individuals to use that will allow them to better manage their health in between visits to their doctor or their primary care physician. So by enabling these tools, they are able to perform daily tasks to keep them on track. They can set goals. They can become better educated about the nature of their disease and great treatment regimens. And then lastly, we create a dashboard wherein the patient is able to see how they're tracking against those targets. You know, one of the things that we heard from many of our partners on the healthcare plan administrators and providers themselves was that access to care is a really big deal. And as you get out into rural communities across the United States, people have a difficult time getting to see their primary physician, and to see a specialist can be really difficult. So we've also created, as part of this broader platform, a video capability that we call virtual care, which allows any patient who has access to a smartphone, a tablet, a PC, and a broadband connection to connect with their primary care physician, a team of healthcare advisors, family members, to kind of keep them going, you know, to investigate if there's an issue or a situation that needs care, or to just check progress along the way. So we think this combination of capabilities is really important. It's been a long process to get it to market, a lot of work with health plan administrators and with providers to ensure we've got it right, and we feel very good about this.